Welcome everyone to our December health chat. I'm joined today by Nicole Miller and Marsha Portis. Nicole's from SETSAG and Marsha's from Trustmark. And we also have Holly with us from EHIM. I'm going to go ahead and turn it over to Nicole.
Hello. So for December, we just have a few things that we wanted to discuss with you guys. Hope everybody can see that. The first thing I wanted to do is introduce Marsha to you. She's new to Trustmark. Previously, we had Amy Meekley as like our account manager there with Trustmark, but she's accepted another position, so she's no longer on the Grand Blanc account. But we now have Marsha, who has over 20 years of experience in the insurance benefits. She's worked as a client broker and TPA perspective, managing accounts, and she's worked on retaining clients and served as a primary benefit counselor for over 3,000 employees that were located in multiple states. And Marsha is excited to start working with Grand Blanc Community Schools here. Marsha, did you want to say hi?
Hi, everyone, and nice to meet everyone. I look forward to working with you.
At this time, I'm going to turn it over to Holly to discuss the mail order that you guys have through EHIM.
Thanks, Nicole. Thanks for having me on here today. My first chat with you guys. I'm excited to participate. So today we're going to talk about mail order prescriptions, how to get registered, how to get them ordered, and get on their refill system. So Walgreens recently, in the past couple of years, rebranded to a company. They're now called Alliance RX Walgreens Prime. So you'll see that information that will be distributed, it'll have that on there. The information you're going to need to have on hand is listed there. You basically want to have your ID card on hand when you go to register, as well as some type of payment form so that you can pay for your copays through the mail order system. You want to go ahead and jump to the next one? You have 2 pages. So to get registered, there are a few different ways you can go to get registered. One is online, walgreens.com/mail service or mail order. Either one will work, but walgreens.com/mail service, and then there's a registration that you'll go through there. You can also do it by mail. There's a registration form that I've provided to Nicole that she will make available through Anita that you can use if you want to do it by mail. And then, of course, there's the option to call Walgreens at their 800 number. And you have your information ready. And most likely at that point, you would want to go ahead and give them your physician's information. Because when you want to order your first mail order prescription, you definitely want to give it a couple weeks. You don't want to, start that process when you've only got a few days left of your medication. So you do have to have a new prescription. You can't transfer open refills between mail vendors, unfortunately. So what I would suggest doing is get with your doctor to get your refills, get your new scripts, and get a 30-day, have them write a 30-day and a 90-day. So you can go to the retail pharmacy, get your 30-day script, and while you're utilizing that, get that registration going, submit the 90-day fill to the mail order vendor, and then it'll just start to flow from there. So by the time you're getting low on your 30-day, you'll have your 90-day script, and then you'll be going from there. You can order through, again, your doctor can e-prescribe once you're registered directly to Walgreens. They could fax in your prescriptions, or they could mail them in, or of course they can always, reach out to them. You do have the ability to do also an auto refill through Walgreens if you want to select that through your member portal once you set that up. So it'll automatically send those prescriptions out once available. Just a couple other little items. The current copay structure, depending on which plan you're in, for the most part is a 2 times copay. So basically what that means is you're going to get a 90-day supply or 3 months for the price of 2. That is the same as if you used a retail pharmacy, but it has the convenience, of course, of having your medications delivered directly to your home. In days of COVID, where we're trying to interact less with people and not be out so much, that has become much more popular than it has been in the most recent past. The only other thing I do want to mention, for some people, they have a pretty good relationship with their pharmacist. Maybe they don't want to, not have that relationship. And that's certainly the option that members have at Grand Blanc is they can get their 90-day scripts through a retail pharmacy if they enjoy having that relationship and maybe using a local mom and pop type pharmacy. But for those that like the convenience of being able to get their 90-day prescriptions mailed to them through the mail, this is a very good option for them to accommodate. But overall, I think that hit the key points that I was looking to touch on. If there's any other questions, we'll be happy to address them in the future.
Holly, one quick question. If I'm on the high deductible health plan and I haven't met my deductible yet, am I paying 2 times what the cost of the drug is, or am I paying for all 3 months of the drug cost?
That's a great question. Under the high deductible plan, you would actually be paying the full cost until you've met your deductible. And
So I
then
would pay for the full 3 months cost.
Correct. Yep. You would pay the full 3 months cost. And it's not until after the deductible when copays would come into play, your $10 or $40 copay. At that point, those would be the multiple of 2 versus paying the full cost during the deductible phase.
Okay. Thank you for the clarification.
You're welcome.
The next topic we're going to discuss is Teledoc versus the telehealth benefits that you guys have. I know Anita emailed out last week to the district employees some information, but we just kind of wanted to go over it again today. We do have additional information on that mail order prescription that Anita will have available on your website and some stuff about the Teledoc. The first thing is Teledoc, which I see I have a spelling typo on the screen still. This is available 24/7, and it is, you call in or you log into the website to get access to the board certified doctors. And then you will be able to discuss with somebody your health concerns. This is normally going to be something like a pink eye. I have a cold, just need something for that. You got to create your account on teledoc.com, and there is a $45 copay for this service. Now, telehealth is slightly different because this is where you can see your providers. So your primary care physician that you're comfortable with, you see them all the time. Maybe it's your dermatologist, again, in the times of COVID, this allows you to see them virtually without going into their office. You would still need to schedule an appointment with the provider's office, just as if you were going to see them, but they would set up a call or a Zoom conference meeting or some other virtual thing. I don't know, Google Meets or some other thing for you. This would have the same copay, or it's applicable to your deductible, just as if you saw them in person. So if you're on that high deductible plan and you haven't met your deductible yet, you would still pay the full contracted rate until your deductible has been met. The federal government started this at the beginning of this whole COVID pandemic, and it was set to expire at the end of this year, but we have continued this to be available to you guys indefinitely. So this will be convenience. If your providers will continue to have these virtual appointments, you can continue to utilize them. Hopefully when the pandemic's over, you'll be comfortable to go back to the doctor's office, but there might be those times where you still need to call them or whatever. And as long as your providers are still willing to do that, then it's still a covered benefit, again, just as if you were to see them. We didn't have a lot to discuss, and that's kind of the end of our presentation. But as always, if you guys have questions or concerns, or maybe you have an idea for a presentation for the future that you'd like us to discuss and maybe clarify for you a little bit, you can always contact me via email or phone, and we can get those scheduled.
I just had one question on the Teledoc. No, it's $45 even if I haven't reached my deductible. Is that correct?
Yes.
Okay, I just had that quick question. Thank you so much for joining us. I think that was valuable information. Somebody asked me the question about mail order prescriptions, and I didn't really even know the details about that. So thanks, Holly. That was great knowing where to go for that and how to enroll. And then Marsha, it's great to have you on board. I just wanted to get your name out there and let all the Grand Blanc school employees know that you're our contact with Trustmark. Happy holidays, everyone. Thank you.
Thank
Yes,
you.
happy Merry Christmas.
Yeah.